one thing that we really want to celebrate, Peter, having this conversation 1 year ago, us three would be like, anecdotal. Sure, there's a couple studies, but what does the World Health Organization of pets think about this? Well, the World Small Animal Veterinary Association has just recently updated the global neutering guidelines. Finally, we have validation with the largest organization in the world. It is a cause for rejoice.
Hello, everyone. I am thrilled to have the one and only Dr. Karen Becker and the one and only Rodney Habib here. I've been looking to this conversation for a long, long time. As most of you know, they're New York Times bestsellers or authors. They're authors of New York Times bestseller. Dr. Karen Becker has been a veterinarian for a few decades, has been an integrative vet who has been in the forefront of many different activities or progress at breaking points in veterinary medicine or changes, revolutionary changes. And you, Rodney, have been representing dog lovers and pet lovers for a long time. You both have done amazing work, and I'm so grateful that you are here. And today we're going to be talking about hormone-sparing sterilization. We're going to be talking about hormone replacement therapy, and also the newest and updated news on hormonal health in pets. And I'm so glad to have you here. Hi.
Hi.
Thank you so much for having us. We're super excited. Last time we were all together, I think it was in Prague, if I wasn't mistaken. So it would have been nice to be all together again, but at least we can do it virtually.
It would have been. And, I find it very interesting because at the time you visited me, my dog Pax started limping. And that was the start of me searching for the answers to his lameness. And I never would have guessed that hormones and his hormonal health and him being neutered actually was the cause of his problems. But we're going to talk about that later. Karen, I know that you have been sounding the alarm for quite a few years about hormonal health and neutering and spaying dogs. Can you tell me a little bit more about that and what happened, how you stumbled across, or maybe just really focused on hormone health in dogs?
I can certainly give you a background. I'll try and sum it up pretty quickly. I started working at a kill shelter when I was 14. I started volunteering there at 13, became an employee, cleaning cages at 14, went through the Iowa State College of Veterinary Medicine euthanasia technician program when I was 16, and then actively became the lab tech at the kill shelter, euthanizing anywhere between 200 and 500 animals a weekend. That's a hard go at 16. And looking back, that has not just profoundly shaped my ethics and morals about a lot of topics, it created a lot of PTSD, honestly, that I've carried with me through a lot of my career, in that the overpopulation crisis in the US is front and center and very real. Euthanizing healthy puppies and kittens is an incredibly miserable thing to do, and something that when I finally became a veterinarian, I vowed I would never do a convenience euthanasia again, and I haven't. I've not done that because I promised myself I would get the tools and or the resources to never allow that to happen, and I've been true to myself with that commitment. The overwhelming overpopulation crisis in the US also caused me to do everything within my power to do what I can to minimize the number of animals dying. And for me, the logical thing was, if we spay and neuter everything, then that at least slows down the overwhelming unnecessary deaths that people in doing humane work and rescue are forced to do. We're doing the dirty work of others. I have never had an unplanned pregnancy with any of my animals, and yet humane workers and shelter workers are left doing this devastating, overwhelmingly dirty job of euthanizing healthy animals. So what can I do as a veterinarian to help slow down this really awful cycle? I can spay and neuter everything that I touch. And that's exactly what I did, Peter. I went into practice in 1999 and I spayed and neutered everything before 6 months of age because I believed, and I told my clients, that that was the very best way to help minimize overwhelming population issues that we didn't want. When I started connecting the dots, is that I also had an exotic animal hospital, and I connected the dots through ferrets. Ferrets are spayed and neutered at 3 weeks of age, and 90% of ferrets die of adrenal-related diseases directly linked to early spay-neuter. And I started seeing all of these ferrets with insulinomas and adrenal issues, thyroid issues, and cancer that were dying midlife. And I was like, I wonder if that has something to do with early desexing, because I started seeing all the dogs I desexed from 99 to about 2004. I started seeing all the dogs present with very similar symptoms: obese, poor muscle tone, recurrent soft tissue, ligament injuries, musculoskeletal issues, Cushnioid-like thyroidy looking. And I started thinking, boy, my ferrets and my desexed dogs are looking very similar. So I contacted Dr. Jack Oliver, who started the endocrinology department at University of Tennessee Vet School. He really became my endocrine mentor. And I said, Dr. Jack Oliver, I'm an exotic vet. I also do dogs and cats. I'm seeing my dogs look like my ferrets. Is there something going on endocrinology with their endocrinology system, in that we're desexing them early, and that maybe this is not, we're causing this hypothalamus adrenal pituitary axis shift that could be causing lifetime issues? He says that's exactly what's going on. So I said to him, I'm nervous, because I was the vet that recommended that we desex all I have thousands of dogs now in my practice that I desex between 8 and 5 months of age. And I said, so what you're saying is all of these things that I'm seeing were because I insisted on this decision and told my clients it was for their health to do this. He said, yes, that's right. I had to take a deep breath, and I said to Jack Oliver, the only thing I can do now, other than apologize to my patients and my clients, is to do what I can to try and help fix this, because I didn't know any better. I said, would you give me a discount if I buy mass adrenal panels through University of Tennessee? Can you reduce the cost so that all of my desexed dogs, I can begin testing their adrenal system to see what I can do for reparative action? And that's what I did. So we established a database of neutered dogs through the University of Tennessee endocrinology lab through this Jack Oliver connection. And what I was able to see is that all of these dogs that I desexed early had massive and really irreparable endocrine crises happening in their bodies. That was my story. And I started connecting these dots in about 2006-ish. And that is when I started having really pivotal conversations with my clients about no longer doing this, no longer automatically spaying and neutering everything that I saw. And it was very confusing to my client base, because I went from insisting on it to recommending the exact opposite. And that was circa 2006. So that's kind of my backstory.
Wow. It's, it reminds me of my story as well. And I am too guilty, in quotation mark, of recommending everyone to be spayed, because we see the homeless animals, we see the shelters, we see the suffering, we hear about the shelters where healthy animals are put down. And I think that we really need to be kind to ourselves when it comes to that, because we did not know at that point. There are many instances in medicine where we just basically use a treatment because we think that we are doing good and we are helping the animals. And then we eventually learn that maybe some of the treatments are not as useful or maybe even harmful. And that's the point where we need to shift and pivot. And I've done my best to not only educate myself, but talk to the researchers and scientists as well. And now it's time where it's ripe and we're ready to actually transform. And I think that it's going to take a couple of years because it's the right timing. The timing is everything. And now I would like to ask you, Rodney, because you're a pet parent, and I think that you're the only one who has not really been actively involved in neutering and spaying animals. What was your experience with veterinarians who you dealt with and who were trying to convince you that you have to actually neuter and spay your animals? And I believe that you have a female canine in your life who is not spayed. Is that right?
My beautiful little girl Shuby right there on the front of the cover. She's an intact and the love of my life little bugger, that dog. I am like the quintessential first-time pet parent that would most likely be listening to this, where you want to do everything absolutely right from day one. When you bring home your dog, you fall in love instantly, and you're like, what are the steps I need to take to keep this incredible creature beside me for all of time? And this has been a very touch and go subject for me. I was, fired by my veterinarian, a story that I've told with Dr. Becker on our podcast a few times over this spay and neuter issue as I started to learn more. I'll tell you as a as to my fellow pet parents who are probably listening right now, when you first get your dog and you first walk into your clinic with your beautiful veterinarian, I kind of believe the research that they have, the research the groomer has, and the research the trainer has is of the notion that when you spay or neuter your animal, and Dr. Becker had said this earlier to me today, they're perceived healthier. I never really thought it in that way, but I guess if you were to summarize all of the different points that seem to get better, as in behavior issues go away because you're always told, obviously, as a first-time pet parent, spay and neuter the dog. It calms the dog down. They become a calmer, better creature. You're not going to have behavior issues. A really big one with a lot of pet parents, spay and neuter your animal because you're not going to get cancer. Right? You won't, the mammary cancer or testicular cancer and so on and so forth. So you want to avoid those cancers as a pet parent, right? Spay and neuter your dog, you'll save money. They eat less. They're eating ravenous now, but when you spay or neuter them, they don't require as many calories and you save a whole bunch of money, right? Mm-hmm. Obviously, the key one is spay and neuter your pet because nobody wants a bunch of babies, puppies roaming around your house because that would be very, very stressful for a first-time pet parent. So when you hear about all of these issues, I mean, it seems like a no-brainer to spay and neuter. And obviously, I was of like the pet parent that was out there, let's do this as quick as possible. My veterinarian at that time that told me that, anywhere between a 3 to 5 month mark is totally fine, which ultimately in the end got me fired from her clinic once I got into the science of things. So I spayed my dog. I'm going to say anywhere, she was an early spay, probably around the 5 month mark. And Peter, that's what opened my eyes up to all of the issues that my dog was having. And then upon my research, at that time, I wasn't writing for magazines. I wasn't doing any research. I was just that pet parent that was like the norm, right? Everybody else is doing it. My neighbors spayed their dog. I go to the park. All the dogs down there are neutered. Why wouldn't my dog be neutered? It just seemed like a normal thing to do. And boy, oh boy, I hit every single problem that you can possibly think of when you start looking at the research and the science that's out there pertaining to disrupting that feedback loop, that hormone cycle of your pet. And I had to learn the hard way, sadly.
I so appreciate you sharing your perspective and a little different perspective than Karen and I. And I think it's a good spot for us to explain how the hormones work just in a nutshell and make sure that everyone understands what happens when dogs are neutered. So, I had it happen with my dog Pax, and I've been basically in the books and diving in the research a lot. It is a very big mistake to see hormones as a means to reproduction only, because the hormones obviously have multiple different functions, metabolic functions. They affect the brain, cells, organs, tissues, and so on. Once the gonads are removed, what happens with the pituitary gland? It basically starts producing or overproducing luteinizing hormone that would normally stimulate the gonads, whether it's ovaries or the testicles. Once the testicles are missing, the luteinizing hormone goes from 3 units to 90 units or even higher, 150 units. And it starts causing inflammation in tissues. The receptors to luteinizing hormone are all over the place, in the thyroid gland, in the ligaments, in the muscles, in the bones, in kidneys and liver and all that. And they basically get inflamed as a result of the elevated, unnatural level of luteinizing hormone. And because there is no gonads, the pituitary gland still thinks that there is no hormone. I have to stimulate more luteinizing hormone. So this is the big issue that we were unaware of. And the studies by Dr. Michelle Kutzler, as you know, have been derived from humans, from females in menopause, where the luteinizing hormone elevates and they start experiencing pain and different symptoms in the body, and also behavioral and emotional changes. I find it so interesting that for years we did not clue into this. And if there wasn't my dog Pax, my best teacher, I would have probably not known about it for a few more years, or maybe I wouldn't focus on it. And it's so interesting that when you visited us, Pax and I, and my partner in Prague, it was the moment he started limping. And I remember we were offloading him from the car, and he was running in the park somewhere, and he hopped out of the car, and he had one of his hind legs lifted.
I remember that.
And I was terrified because he was too years and a bit. And I remember you were concerned as well. And I think that, in the universal scheme of things, he already was kind of knowing that that's the time to actually show what's going on. And so now we're sitting here almost 3 years later, where everything is solved, and I will share the rest with the audience. What the results have been. But do you find it interesting that our dogs come to us with this amazing learning, whether it was your situation, Karen, or your situation, Rodney? I find it really hard to believe that it's coincidence. I think that it's just there, like it's just meant to happen.
I think that our animals are our best teachers, and that it is absolutely not fluke or happenstance, that the lessons, the topics, the things that we need to learn from and to best provide the best care for our animals, those lessons are oftentimes some of the best universal things we can share with others, because they are also going through the same thing. And so I think that PAC's showing us all at the same time when we were together, hey, this is happening in my body. I distinctly remember it was a shifting leg lameness. He did come up, it was very subtle. He did come up and pick a back leg up, but then do you remember we were crossing the bridge and he offloaded? He had a little bit of a front left carpus thing. And I'm like, listen, that's not a rear right. That's a front left. So it was just a step or two and then right back to normal. But the entire time we were together, he was showing us these very subtle incidences of 2 to 3 second lameness, but it was shifting leg lameness, which I think is oftentimes, being a woman in menopause, that is exactly what it feels like. Today it's my left hip. Ooh, tomorrow it's my right elbow. Next week it'll be my left ankle. That's exactly what hormone deficiency aches and pains present as. And so I am a believer that our animals provide the best teaching opportunities for us, not just to help them overcome their challenges, but for us to learn and grow and help others with animals dealing with potentially similar situations.
And it's so interesting because now everyone who's listening is probably thinking of how these situations present in their lives. And I know that we have many, many women in our community as well. And once again, it's really touching for me to feel that we can make a difference in the lives of many dogs. Also that people will benefit. And this is the beautiful part. Like, how do you feel, Rodney, about not only making a difference in the lives of our pets, but knowing that whatever you write about and teach about is going to reflect and trickle down to the humans? And it must be amazing.
It's a very gratifying and a very I'm blessed by the universe to be able to work with incredible people like yourself, Dr. Karen Becker, scientists around the world. The passion that dogs bring when we talked about this when we were writing the first book, or even just getting a normal interview, regardless book or not. Anytime you call a scientist and you ask for a cold interview, you normally don't get a response. Anytime you email a scientist and you say, hey man, I want to talk about my dog and your dog and how we can get them to be with us for as long as possible. And dogs open up the doors globally, like anywhere and absolutely everywhere. One of the duties, Peter, as a pet parent with a passion of citizen science, is to relay the information that's going to help our pets live as long as possible. And this has been the hardest topic I've ever had to face in my entire career when trying to talk about the detrimental effects to spaying and neutering. When I started writing, I remember years ago for Dogs Naturally magazine, and I would sit down with just a whole multitude of veterinarians, right? So it was a portal for me to get an interview from them to put into a magazine. So it was a great way to steal interviews from, people like yourselves that were in your clinics and busy, and you had giant days, and I'd be like, please, I want to take some of your knowledge and I want to put pen to paper. It didn't matter what doctor I was talking to at that point in the integrative or the functional medicine type world. They all seemed to have the knowledge that there was an issue with spaying and neutering, and there was more and more science coming out. And then when I would try to bring that back to the conventional world and have that conversation with my incredible conventional veterinarian, they didn't know what the heck I was talking about. It got very polarizing to them. Then when I tried to put the like as an example, we talk about this all the time. The lovely Dr. Karen Becker wrote this incredible article one day, and this video that streamlined into the millions on spaying and neutering. And I went into the comment section and I saw what was going on into that comment section. I was like, oh my dear God.
It didn't go well. That initial release, it didn't go well, Rodney.
Listen, I don't know what I was thinking trying to replicate it. Peter, I turned around, I took one of our articles. I was like, you know what? I've done research to everything that she's saying, and everything she's saying, obviously, the cool thing about Dr. Becker back in the day, everything was cited with references, which was really good when you were up and coming, because if you didn't have a reference point for something, it was a really big problem, right? If you're going to come out and you're going to make a claim, boy, you better have a study to back that up. And there was always references in there. So, you'd go in there, you'd read it, and you'd be like, my gosh, look at all of this data. I remember this big, giant clinical this publication that came out of the journals where they took a whole bunch of clinics all across North America, merged the data together, and they found that the dogs that were still intact not only live longer, but suffer less diseases. Those were some eye-opening published research that was coming out at that time. I took Karen's article, long story short. I put a beautiful picture to it. I summed it down to 3 paragraphs. And the attacks that I took online for talking about something that was right and right in my heart, you're going to tell me my dog could live healthier, my dog could potentially live longer if I kept my dog intact and I was A, a responsible pet parent, and B, my dog didn't have any medical conditions. Why wouldn't I do that? Just somebody tell me that, though, because if you don't give me that information and then I go and I do what I did to my first dog, Sam, who I spayed at 5, who blew both of her knees.
5 months.
Sorry, at 5 months, who developed cancer, blew both of her knees. University of California, Davis published that 10-year study that came out that's saying you can increase the issue with joint disorders and cancer in animals in specific breeds. Be careful. Nobody gave me that research, Peter. And so
yes,
to go back to your original question, how do I feel? It's my duty as a pet parent, right? It's my duty to the people that support us that are looking for that type of information, but it didn't go well. And the shelters came out and I remember a vet technician sending me a picture to this day. It was ingrained in my brain of blood on her hands. And she said, these are your hands now, and you are responsible for the death of millions of puppies across North America because you shared that information. We know that animals could live healthier and longer, but you're not supposed to talk about it. There's things you're not supposed to talk about. And that didn't go over with me very well.
No, I understand. And I think that, any time in the history of humankind when there was something that was clearly better or there was need for shift and change, it's first met with fear. The famous bloodletting and all these different medical treatments, right? Like we eventually had to change. And when it comes to spay and neuter, we are not necessarily saying that no animals should be sterilized, but we are saying there are options, and there are options for responsible dog owners who probably are very capable of keeping their dogs under control and not breeding unwantingly. And then there are those who are not responsible. So if there are rescue organizations, I understand they've seen the world through a different lens, but it's pretty clear and evident that the research is there. Animals are not as healthy when they're neutered and spayed. And once you experience it in your own life, and I have, and seeing the agony, and I've been a vet for more than 30 years, and I really focused on creating healthy and long life for other dogs, but also for my dog. And it just it's a great mission. But when you realize that you're failing and that you're missing something, and the missing piece of the puzzle is hormonal health, then it's impossible for us to just kind of stay quiet, because I can only imagine how many pet parents are dealing with chronic conditions and premature loss and cancer and all those conditions, and they could be prevented. Karen, how do you feel about the incidence of chronic disease, and what do you think could actually change, and how it could transform general health and veterinary medicine if we actually start addressing these issues and acknowledging that there is a problem, and if we actually start seeing intact animals? What conditions do you think we will see less often?
Yeah.
What do you think we are going to see overall?
Well, I'm going to read you a quote from Dr. Michelle Kutzler, because this quote I have printed, I repeat, I cut and paste it. This quote summarizes our discussion so succinctly that it's basically a mic drop. So excellent job, Dr. Kutzler. Let me read it to you. Gonectomized dogs, that means spayed and neutered dogs, have been reported to have higher incidences of obesity, urinary incontinence, urinary calculi, that means bladder stones, atopic dermatitis, aka allergies, autoimmune hemolytic anemia, hypoadrenocorticism, that's Addison's, diabetes mellitus, hypothyroidism, immune-mediated thrombocytopenia, inflammatory bowel disease, hip dysplasia, cranial cruciate ligament rupture, aggressive and fearful behavior, cognitive dysfunction syndrome, prostate adenocarcinoma, and transitional cell adenocarcinoma, that's bladder cancer. Musculoskeletal issues may be significantly elevated, the risk of those for large breed dogs that have been gonectomized before they have finished growing, as bone fascia closure is delayed. That's a way of saying that growth plates remain open in animals. Dogs that are spayed and neutered before their growth plates close can have musculoskeletal issues. So that list of all those conditions has been documented and demonstrated a direct correlation through not just Dr. Kutzler's research, but her accumulation. She's amassing research from other endocrinologists and reproductive theriogenologist specialists around the world. There's this growing body of evidence. So what I would say is we will see less of all of those chronic degenerative diseases that you and I see over and over in practice as a direct result of hormone deficiency. Mm-hmm. So what we'll see translationally is healthier animals if we decide to leave hormones available to do their lifelong important job. Now, I do want to make a very special distinction, Peter, because for responsible pet owners like you and Rodney, there would be not a problem, just as Rodney has done, leaving Shuby intact and leaving your dogs intact. I'm a girl who will never go to a breeder and buy a dog. I will get my dogs from the Humane Society or rescue till the day I die, because that is just where my heart is. Mm-hmm. That being said, I also recognize that humane societies must do something. You're not going to release an animal that has not been sterilized. But we now have available very safe, easy, cheaper techniques like hysterectomy, the removal of the uterus that prevents pyometra and also prevents babies but leaves the ovaries fully functional, and vasectomy, which prevents impregnation, but also leaves a male dog fully hormonal. We have these easy, simpler techniques. The problem is no veterinarians know how to do them. So what I am advocating for is that humane societies and high-volume spay-neuter clinics consider becoming high-volume sterilization clinics using different techniques, which accomplishes the same goal. We're releasing young animals that are rendered unable to reproduce, but they are not rendered endocrinologically damaged, which means they no babies, but they're fully hormonal. That's going to take some time and energy and a different educational curve, because veterinarians are not taught, you and I were not taught how to do any of these simpler, cheaper procedures. So there's going to need to be a learning curve. I advocate for animals to be sterilized, but just using different techniques. And I believe that long list of diseases that Dr. Kutzler has directly identified, all of those epidemic degenerative diseases we're seeing could be reduced if we just switch techniques.
For everyone who's listening and watching, Dr. Michelle Kutzler has done an interview with Dr. Karen Becker here and also myself, and we will put the links in the description. I fully agree that hormone-sparing sterilization will have a very valid place, and I know that the rescue organizations and humane societies will be very much adopting these methods. It's just a matter of time. The unfortunate part is, and I sometimes go through parks and meet people, and it's happened several times in the last few months where I start talking to new puppy owners and so on, and they would tell me, "Oh, the surgery is scheduled next week," or they share the story and so on. So I immediately provide the links and provide the research, because as you said, Rodney, it's super important, and Karen, you too, to actually have research that is there and available, because it's undeniable. And once you actually connect the research with the practical experience, it's mind-blowing. With PAX, I have done hormone replacement therapy where I actually neutralize the luteinizing hormone with a GnRH agonist, which in simple terms reduces the luteinizing hormone production eventually. And so I gave him an implant, which is called suprelorin. And because I like to tinker a little bit, I've given him just the suprelorin for a month. And it was like, he looked the first 24, 48 hours, he looked like he ran a marathon. He was sleeping, he was relieved, but he was sleeping and very much in a different state.
Peter, can you explain, sorry, I don't want to cut you off. Can you explain that implant for people that are listening that might not even know what that is or how that's even optional or how that even works?
Yeah, so what it does basically, so if you have the luteinizing hormone in a neutered animal or spayed animal, it causes inflammation. And this is what exactly was happening in PAX and what's happening in millions of other pets. Based on the research that Dr. Kutzler and Dr. Linda Brent from Parsemus organization or foundation did, they basically developed a hormone replacement therapy plan. So the first step is to introduce this implant, which neutralizes the luteinizing hormone. It's called suprelorin. And when you introduce the implant, basically the luteinizing hormone surges first, and then it drops because the pituitary gland somehow reduces the receptor. So there's some sort of mechanism that reduces the luteinizing hormone and stops it. Originally, this medication was used for basically hormonally sterilizing male dogs. But now we can, because it also reduces the luteinizing hormone and it stops production of the sperm. However, in neuter dogs, it reduces the luteinizing hormone and it reduces the inflammatory process in the body. But after the month of PAX being on suprelorin, I started seeing some skin side effects. So I started seeing him losing hair and scratching and itching, which was documented.
Okay, so it shifted his skin microbiome.
Well, not only that, I think that it really did disrupted his hormonal balance. And as soon as I introduced him with testosterone, a very small dose of 0.5 milligrams per kilogram weekly under the skin, insulin needle, very simple treatment. Pretty much within 2 months, I had a different dog. Wow. Within a week after introducing testosterone, I started to see that his back stopped being sensitive. You know how you sometimes touch your dog's back and you have what we call panicular reflex, that they twitch their skin. Or he was rolling on his back before everything stopped. It was like calm after the storm. And within 2 months, and I was, the first month I was thinking, man, he's still limping. Like, what's going on? And I was really impatient about it. But mid-June, I remember that it was mid-June, suddenly he stopped limping and he hasn't limped since. And the transformation, and I'm going to show you some pictures and some videos, but the transformation has been so profound that from people saying, oh, is he a little older a year ago to, oh, he's a puppy, right? Puppy. And not only physically and muscle build, but hair coat and his behavior. I thought I had just an aging dog that was just settling down. But I think that he was depressed. I think that he was going through the same symptoms as women in menopause and men in autopause later on when men get grumpy and kind of depressed. It just taught me so much about hormonal health. So now I think that there's nothing else that is more important than actually addressing this issue in veterinary medicine because, it's profound.
I wish I had brought this up early because for your listeners that are listening to this point and listening to the information and the experiences and everything we're sharing, one thing that we really want to celebrate that I know we're waiting as we go into the show, but just in case these people with the short amount of time that they're in here, you really want to stay on board here because the World Small Animal Veterinary Association has just recently updated the global neutering guidelines. Like this is the biggest cause of celebration because no longer this information, Peter, having this conversation 1 year ago, us three would be like anecdotal. We're like, sure, there's a couple studies, but what does the World Health Organization of pets think about this? Well, my friends, if you are still here and you're listening and you're on this journey with us, Wasava has just updated the guidelines. So, to what these two incredible doctors are attributing and saying and highlighting today, finally we have validation with the largest organization in the world. And I'm sure we'll touch on that a little earlier. But boy, we really should bring that one up because it is a cause for rejoice.
I have to confess, just about 10 minutes before we started the broadcast, Rodney sends me this information and I completely missed it. It was published in June 2024. And because I've been focusing on the research and the issue so much, I completely missed this piece of information. When I saw it, I was so thrilled.
It's like a dream.
It is.
And I know that you, Karen, have been also participating in petitions and really making sure you collected how many signatures to make a change in the guidelines?
We're at 17,000. And part of the reason I started that petition almost a year ago, October 2023, I got really exhausted after going, I've been working on this issue for about 15 years, trying to educate pet parents, also trying to educate my colleagues.
Mm-hmm.
And what I found is that at this point, our worldwide proactive wellness community of about 6 to 10 million between Rodney and I, we have a group of highly educated, empowered advocates. They understand this issue fine. What I've realized is it's actually my conventional colleagues that maybe haven't kept up with the research. That my biggest hurdle right now is trying to convince my veterinary colleagues that young students in vet schools deserve to learn some additional techniques, because every vet, if they haven't already, they're going to start getting educated pet parents saying, hey, I'm interested in sterilization, but I'm interested in also preserving hormones. What do you think about doing vasectomy? We know those questions are coming to veterinarians. So the best thing we can do is equip our colleagues to be able to have intelligent conversations, but also know some of these hormone preserving techniques so that they can, when appropriate, they can offer these new updated techniques to their clients. None of that's happening. So this is before Wasava changed their guidelines, but mostly I wanted to show AVMA and Wasava, as well as the North American Veterinary School Associations, that there is a strong interest from pet parents in North America seeking hormone-sparing surgical technique alternatives. And I wanted to demonstrate that. So we're at 17,000 signatures. And it helps a lot that Wasava a few months ago has decided to publicly announce that they also recognize that there is now enough body of evidence that the blanket recommendation of automatic spays and neuters is not hormonally or endocrinology in a dog's best interest. The one thing we do have to stop right now and talk about is kitties. Michelle Kutzler is very clear about this, and this is the piece that can become confusing. Kitties have an entirely different reproductive system than dogs. Cats are induced ovulators, and cats, at least to date, they do not have the overwhelming long-term side effects from early desexing as dogs. So I do want to make it very clear that when our community of proactive veterinarians discuss this topic, it really is canine specific, and I'm thankful for that. We've not seen this overwhelming body of evidence for long-term irreparable side effects with cats yet. So I do want to make sure that we're discussing dogs in this conversation, because cats can undergo early spay neuter, and we've not seen this overwhelming detrimental side effects. But that being said, yes, I started a petition because so many of my colleagues said, you're out there, there's no science behind what you're saying, and it appears you're just trying to grow this body of completely irresponsible pet parents by undoing all the hard work that we've done over the last 100 years we finally convinced the world to spay and neuter. And now you, Dr. Becker, are single-handedly undermining this effort that was heartbreaking to hear from my colleagues. So I started this petition to really better educate my colleagues, but also to help provide potential tools to graduating veterinarians. I wish that I would have had training in vet school to be able to have these conversations and know different techniques. And I didn't. And I want that for our younger graduating upcoming veterinarians.
What I like about you, Dr. Becker, Karen, is that you have the humility of saying, hey, I've been making mistakes for many years and now I learn differently. And you just hop on board and you just dedicate yourself, your time and energy, and don't really care what others think about you. You know what your truth is, and you know that the knowledge is solid, and then you go for it. And this is something that really is admirable, because I know that you've been ostracized. I know that sometimes you've been pointed to as the irresponsible one. But when you look at history, everyone who is a trailblazer actually suffers from this, and it's just the torch that you have to bear. But you're really a pioneer, and I'm so grateful that if we have the humility of saying this, and seeing that we have to learn and continue learning the whole life. And when it comes to you talking about veterinarians not adopting the methods yet, I think that it's just a matter of time, because people will be listening and hearing and reading and learning, and they'll be demanding it. And as we know, usually the customer or the market demands will shape veterinary medicine. And I think it's just a matter of time. And there are already many people who are doing hormone-sparing sterilization. But Rodney, I also wanted to ask you, like, how do you see any avenue to address this resistance? Do you have any ideas how to approach it?
Obviously education. I mean, look, if it's when the pet parent has two forms of knowledge, all right, so let's say current science and folklore, it's going to be the one that's going to resonate the most with the pet parent as to the decision they want to make. I do want to fully answer this question, but I also do want to read the statement. I have, because like, listen, I have it saved right here on my phone. You can't see it because my camera is such a bugger, but for those that want to go check it out, if you go into the introductory section of the new WASAVA guidelines, it states, in cases where there is responsible pet ownership, best practice may be to leave the animals unaltered unless there is a medical necessity to intervene. Leave the animals unaltered. Like, holy moly. This, we, Karen and I, when we talked about this, we had, small tears of joy. I mean, the work that, for all of the integrative veterinarians right now listening, for all of the groomers and trainers and people who are listening that knew this science, that had this science, held it close to their heart, and are trying to inspire change. I think this was the biggest sigh of relief for everybody when the largest organization in the world says, yes, there is a problem, there's been a problem, and we need better techniques, right? But to go back to answer your question, Peter, you have to get rid of the stigma first, right? I want a better behaved animal. This is a really big one for a lot of people, right? So as a pet parent, one of the things that we have to do in this educational portal is, well, I'm neutering my pet at 6 months. Sure, the research says they might live longer, but I don't want them to be aggressive and I don't want them to be harmful. Therefore, I'm going to remove their hormones, and this should be a good idea. Mm-hmm. So when we brought Dr. Michelle Kutzler onto our podcast, that was the first thing that she addressed. In cases and situations, 2 studies that were published, there's also an article published in Psychology Today showing that there's actually an uptick in aggression when you desex these animals, not that old stigma that people have. The humping is one. I mean, it seems ridiculous, right? Like, humping, come on, this is what you got 3 educated people on a podcast here talking about humping, but that's a big thing for pet parents. The dog's humping the pillows, he's humping the kids, he's humping anything that he can see. I'm going to snip the bastard because it's going to stop all the humping that's going on. Guess what? My neighbor can attribute to this. It did not stop anything. If anything, the dog seems to, these sort of behavior issues that we're having, these small things that I don't even say with pet parents, more pet owners, if you may. I always think the pet parent is the 2.0 version of the pet owner. The pet parent who gets these dogs that finds that some of these behaviors or these inconveniences are the reason why they're doing this. When you start racking up vet bills, man, when you go, like, as an example, my dog, who I spayed at 5 months of age, she blew her first knee. So if you're listening to this and you think, okay, well, no big deal, I'll go get the surgery done. Here in Canada, when I went to get that surgery done, that was a $3,500 surgery. You may say, okay, well, I'm out of the clear here. No big deal. Price rehab and therapy that you have to do after that knee is blown. If not, it's almost the exact same price you got to go through. Oh, and by the way, in less than the year, the other leg's going to go. Mm-hmm. And then you're going to have to price rehab on top of that as well, right? All repercussions of an early spay that I wish somebody told me, but nobody did. Oh, and by the way, 5 years later, the dog develops spindle cell sarcoma on the side of her body, cancer, because you have now a higher increased rate of developing some of the most aggressive cancers in the world. Mm-hmm. Go price out a session of one round of oncology. If you sit with an oncologist, a veterinary oncologist, and tell me one round of treatment, that can go up to about $10,000. Well, now you start adding up these bills, you're $20,000, $30,000 in, and no one educated you. So Peter, it's education. It's going to be education and inspiration as to why you want to do this. When we tell the stories, Dr. Becker and I, of all the longest living dogs in the world, what do they have in common, Karen? I'm going to quiz you.
So every single one of, when Peter, you were there with us, every single
Absolutely.
one of the exceptionally long-lived animals, they were intact, right?
Mm-hmm.
And they lived out, well, they spent a ton of time outside and they were hormonally active their entire lives, right?
I'm so glad that you started talking about behavior, because I've been fortunate to live in two places, my home country of the Czech Republic, and I've lived in Canada for 30 years. And it's been absolutely mind-blowing. And for quite some time, I was a little puzzled, because I've seen a difference in behavior of dogs in Canada and here in Czech Republic. But I thought it was just cultural. And then I started to clue in. Most of the dogs here in Prague are unneutered. They're intact. They have amazing social skills. They actually, and you've seen that here, like dogs kind of sniff each other and say hello, and they're all off leash and they're behaved and they're almost like more responsible and mature. And then you have the dogs that are neutered in Canada, and I thought that they would be less aggressive. Is the opposite. Like we just came from Vancouver a couple of weeks ago, and I must say that I was really disturbed by the state of affairs there, because pretty much every second dog is reactive. Dogs don't get a chance to actually interact anymore because they're reactive. So it kind of like compounds the whole effect of the situation. And I know that Dr. Kutzler explained this, because the amygdala and the emotional centers in the brain and the hippocampus actually also suffer from the inflammatory changes post-neuter. It leads to behavioral changes and fears and aggression and so on. I actually have seen something mild in packs where when we fly, and he's a service dog for my sleepwalking, so he flies in the cabin. But when he flew after he was neutered, he suddenly became afraid of flying and takeoff. And I remember the first flight we took, he was on his back during takeoff and, relaxed and casual. And suddenly he started being afraid of flying. And it took him like 30, 60 minutes to settle down from this mini panic attack. And the same with escalators. He was trained on escalators, and suddenly he would be afraid of escalators and all that. That has settled down. And I must say that since he has been or was put on hormone replacement therapy, he's much better. It's still not 100%, but I definitely see that. And so the argument that dogs should be neutered for their behavioral issues is definitely not valid. And when it comes to the humping, I will differ a little bit from you. I would say that Pax may be a little more humpy than when he did not have any hormones. But he's happier. He's well socially adjusted. He doesn't jump on other dogs. He actually likes the owners of the dogs, of the female dogs. I have one story that was really funny. We were in the park, and there was a lady with about 5 Cavalier Charles Spaniels, and most of them are girls. And so Pax loved the girls, and he was really thrilled to say hello to them. And then suddenly he decided that the guardian's leg was the right thing to hump. And so he started humping this lady, and she goes, "Oh my God, this is great. It hasn't happened to me for a long time." So this is the Czech attitude towards, everything naughty and so on. Like, people just crack a joke and move on. But it was really funny. But, I definitely agree with you that it doesn't solve the behavioral issues. And I've seen that in practice.
And Peter, do you remember having 20 years at a shelter where you see a lot of reactive dogs? You see the number one reason animals are dumped at shelters is behavior problems. Mm-hmm. So behavior issues is my entire world growing up. Lots of dog fights, lots of emotional high reactivity animals in my past. Then, of course, you become a veterinarian and you see it in the exam room constantly, or in your waiting room, actually, most often, where everyone has to wait in their car because the dogs can't be around other dogs. All of those things. We got to Prague, and you let packs down. I had like a panic response. I was like, oh, do you remember that? You said, no, everything's going to be fine. I'm like, there are 7 intact male dogs in one place. And my thought was, I don't know how packs being neutered is going to respond, but everyone was absolutely fine. All the dogs get along fine. I think part of it is Europeans are out walking more with their puppies. The puppies get a ton more socialization, and they're allowed to have the socialization along with the endocrine development that allows them to have lifelong, more balanced and grounded social skills, unlike early spay neuter in the US and then inappropriate or lack of socialization. Mm-hmm. That blend of poor or inappropriate, inadequate socialization plus early desexing in the US really does set our dogs up for having to work extra hard in the training part of it. And then if you have a mom or dad that doesn't commit to the first 1 or 2 years of pretty consistent, ongoing positive reinforcement training, or if they don't know what they're doing, or they think, you know what, I'm going to go to training when my dog has a behavior problem, we've already missed the boat on all 3 fronts in the US, in North America, actually.
Well, this is an interesting thing that you're saying, because I definitely agree that Europe is better, but I have seen just recently the trend, an uptick in neutering and spaying. So I'm determined to actually to sound the alarm here and make sure that people will not go that way. I also don't want it to sound like there are no aggressive dogs here. There are some behavioral issues here, but when you compare the percentage and the ratios, it's way, way, way down in comparison to North America. And I think that this is something that we really definitely need to work on as a community. And I'm so grateful to have you here and having this amazing conversation with both of you. I know that we are overdue for getting together, and maybe we should just organize tours, European tours of dog cohabitation. And so people can actually witness this, right, with their own eyes and see it. I have one of my team members, one of my directors coming here to Prague. And interestingly enough, she has a golden retriever. And guess what happened to the golden retriever? She just went through the first cruciate ligament tear surgery. We were not able to put him on the hormones early enough because it was just all determined in the last few months. And,
right.
And the other issue is, and this is something that needs to be addressed, testosterone is a controlled substance in the United States. Suprelorin is not approved for dogs. So we are dealing with other obstacles in the United States. And this actually is the real reason why the hormone therapy in this poor dog was not initiated earlier. But she's going to come here and see the difference. And I think that I would definitely, if anyone is planning to come to Prague, we're going to organize a little tour for dog lovers.
I love that.
Tour.
I want to add one more thing, Peter, which is going to be really interesting because, tailing off on the tailwind of behavior. What's interesting now is we're now seeing microbiome research. If you remember, Karen, we had shared a study not too long ago that microbiologists now are looking at the microbiome of intact dogs versus neutered dogs, and the microbiome is different. And so intact animals seem to have a healthier microbiome now there is more research that needs to come out, but then one would realize that your microbiome also controls your hormones, right? And so that's also regulating your mood, your behavior, how things are firing off. And we were talking earlier about especially here in North America, one would predict that there are more castrated animals than there are intact animals, but science is saying now that especially not just North America, but a global level, if you want to think about it, 70% of pets have anxiety and are suffering anxiety issues, right? So if it really was working, we wouldn't be seeing these huge issues currently today of anxiety that's running rampant through our pets.
It's interesting you say that, Rodney. A few years ago, my thought was, I wish I could talk to the dogs that I've desexed. I just want to know how they feel. Like, you can tell that they don't feel great, but gosh, I'd like to have a conversation. So I did the closest thing I could think of. I found human females that have undergone complete ovariohysterectomy. So for medical reasons, sometimes women have to have their ovaries removed. And it's a very eye-opening conversation to talk to women who have been spayed, especially younger in life for medical reasons. I spoke to a woman who had to have her ovaries removed at 21. And she said and I've not talked to any men that have had to have their testicles removed that have not been on hormone therapy, but I have read articles about the mental, emotional shifts that happen without hormone support. It's heartbreaking. And the woman that I spoke to, it was devastating to listen to her explanation of how she felt as her estrogen and progesterone bottomed out to zero. She said that she couldn't synapse. She was constant brain fog, lots of just diffuse aches and pains, but the amount of apathy and moving
depression,
into depression,
yes.
and then just the not really wanting, no reason to live, not suicidal, but no reason to live, no reason to get out of bed, body aches, totally flatlined her joy for life, her desire to want to do anything, and her physiology changes. She said, I just threw in the towel because my life became flatline zero. And I thought, so many of the animals that I've spayed and neutered, that's exactly what happens to them. Now, owners say they've become so good because they become zombie-like.
They sleep on the couch and do nothing. Absolutely. I've seen that.
Yes.
And, there is a doctor, I listened to a podcast just recently who is a women's health specialist. And she talked about these hormonal issues and said, we used to wrongfully accuse women. We had a little acronym or a little abbreviation, WW, whiny women, because they were actually emotionally unstable and they were in pain and so on. And we thought they were just whining. But this was real. So she was also mentioning how misperceived this whole transition or this whole absence of hormone is post-menopause, but also post-surgery, like he mentioned. And I think that it does happen to men, but it happens a little later. I definitely observed men after 60 and 70 being, a little more grouchy and not being as happy. You kind of see the kind of frowny face often, and maybe a little more argumentative and negative. That's what I've observed. Hopefully not in myself, but I just turned 60 a couple of months ago.
God, you don't look at Peter. You still look like you're 39, brother.
Well, thank you.
You take really good care of yourself.
That's the distance at the camera. I make sure that my camera.
No, I've seen you in person. I've seen you in person. You still look like you're 39. You take phenomenal care of yourself. I watch the way you eat, the way you hike, the way you work, the way you meditate. You do so. You really work hard on keeping your external shell
healthy,
rejuvenated, and healthy.
I work super hard. I just had like a good bowl of ice cream before we started this, about half an hour before we started this. No, but honestly, I do exercise and I do try my best because I understand it. But you're describing everything. Everything connects with everything, right? So hormonal health and then nutrition. That I've been so relieved and so grateful to have that task off my back, because so many people ask for recipes, so many people ask for nutritional advice, and I'm never gonna stop being grateful for you writing this amazing book for Dog Life, because now what I can do, I can just say, hey guys, you just go to Dr. Karen Becker's and Rodney Habib's book, and it has amazing recipes. I've even gone so far, I've gotten a copy from you, which I have in Vancouver, and I dragged it actually back and forth, but now I even have a e-copy, because I want to be inspired by making recipes for packs and doing all that. I'm kind of mind surfing a little bit, but I forgot to say one thing. Karen, you were talking about the changes in the body and when women get spayed or have ovarian hysterectomy. I noticed in Pax that he was super sensitive to heat and he was overheating when he was not on the hormone replacement therapy. And that probably is similar to hot flashes, right?
Right. Exactly. And it's interesting. I don't know if you saw the anxiety piece of this, but back full circle, the anxiety piece was something that every single spayed human female I spoke to mentioned, that there was a significant lack of energy and that there was this profound introduction of a growing level of anxiety. And I do think that we see that in across the board that we're having an epidemic of dogs with anxiety for a whole host of different reasons. I believe that the anxiety epidemic is multifactorial, but we can't underestimate the fact that hormones play in to having grounded, balanced neurosynapses, and a healthy, cognitive response is partially balanced by a healthy hormonal system. And once we remove sex hormones, that endocrine web is permanently and forever shifted. It will never self-correct. So there will be a component of behavior change in some capacity. The question is, for your breed, your animal's environment, what will that manifest as? It may be, it may be dog-to-dog aggression. It could be anxiety. It could be separation anxiety. It's going to manifest. There will be neurochemical changes. How it manifests in our dogs is really very specific to our animals.
It's absolutely true. And I also believe for those who have spayed and neuter animals, there is hope and there are solutions. Hormone replacement therapy works for humans. It works for dogs. We just have to make sure that the medication is available everywhere. It's available in Canada and Europe. And I trust that as time progresses and hopefully some politicians will have pets who have been neutered, we will actually get this process fast-tracked. And I'm an optimist and a believer that it's going to happen. And now, Rodney, you're such a community organizer, and I don't know anyone better than you are. How would you actually approach this? Like, from needing to do more research, needing the community to get organized, making a difference in the long run, and as soon as possible. What do you propose?
I'm doing the best that I can today with sharing short snippets of information that create big, massive conversations. I found that to be very successful, Peter, in terms of people can only take this much information and it can become overwhelming to them. As I've started this journey of how to communicate better, and Karen and I talk about this all the time, pertaining to the spaying and neutering issue, we have learned so much in terms of communication, how we're posting, how we're sharing things. The way that we share affects the comment section, which then affects communities, which then affects how the information is spread. First and foremost, if anybody is listening and they too have become inspired to share this type of information, prefacing before you come out with the research, hey, we know that there's an overpopulation issue and we know that this is a really big problem, and we're not telling you to not sterilize your pet, but we're telling you that there's better techniques first and foremost. You start off with that conversation. I am presenting to you a better technique that gives you a better possibility for a better health span for your pet and potentially a better and longer lifespan for your pet, and you're going to achieve the same goal in sterilization. It's a no-brainer, right? So we always preface it and start off every conversation with that in mind, to be respectful to veterinarians, to be respectful to rescues and shelters. And now the conversation has changed, Peter. So that my biggest tip is empathy, putting yourself in the shoes of other organizations before you present the information, and then package the information that can talk to everybody. And guess what? The comment sections are different now. Rather than shelters coming in there with daggers, shelters are coming in and saying, we like this. We just can't find somebody that maybe can perform this technique. But then there's more conversations that are coming in here, and more people and veterinarians are joining the conversation, and change is happening. Yes. So come into it thinking about all parties involved and how you can best cater to all the parties involved to come to the ultimate resolution with a longer and healthier dog, ultimately.
Dr. Kutzler, the theriogenologist that really has done much of this research, has volunteered, and Dr. Kutzler, apologies if things have changed in the last 6 months, but I'm not trying to throw you under the bus, but she did tell Rodney and I the last time that we interviewed her.
She did.
She said that she would be willing to get on a plane and fly to any veterinary college to teach their entire surgical veterinary staff on these techniques and to educate whoever will be teaching the students, so that if the big hang up for veterinary schools is they don't know how to teach the teachers that she is happy to fly to any veterinary school and teach these hormone-sparing techniques. If I was going to rally any type of fundraiser, it's a let's fund Dr. Kutzler to fly to all the veterinary schools and teach them these techniques, because that's what needs to happen now. Whether or not veterinary schools take us up on that, that's the challenge, Peter, that I have found that has been a very strange to me. If you have pet parents asking for a procedure, we've got people coming in the doors of veterinary practices wanting to spend some money on a healthier, safer technique. Why on earth are we not providing the educational opportunities for veterinarians like you and I who are out? We need continuing education courses. Why can't we take CE that teaches some of this information? And why can't veterinary students have access to this information while they're in vet schools? That's the bridge I'm trying to build, is if we can teach vets that are out and students about what's going on and how to provide better services to our clients. Why aren't vet schools taking us up on this offer? And they're not, and I don't know why. But that's the bridge that I think we should build.
But let me add on to that, Peter. To what I've started doing is when Dr. Michelle Kutzler said that, and we have that on live footage on the Planet Pause page, and no one took us up on it. As a pet parent, it was my duty to send it to my veterinarian. Obviously, you send a 2-hour podcast to somebody, it's hard. Clip it. You can clip anything nowadays. I clipped that short little segment. I just texted it to my vet and I was like, hey, just check this out. And if you have time, check out the full podcast. Not right away. Took 1 year. But then guess what? I got a text message back. Oh, by the way, tell all your friends we're now doing ovary spares and vasectomies in our clinic. So planting the seeds, you might not get the response right away that you want, right? But now, especially with WSAVA changing the guidelines, now you can send that with the snippet of today's conversation with Dr. Peter Dobias to your veterinarian. It plants seeds, man. It really does.
I can confirm that Dr. Kutzler actually has volunteered herself to fly anywhere in North America right now to actually teach veterinarians and probably beyond. I too have attempted to actually connect her with 2 organizations. I will not name them because it's not important, but from the initial excitement, it ended up with maybe we are too busy, not right now, and so on. However, I have been able to recruit a couple of veterinarians to be registered at parsemus.org, which is the organization that sponsored some of the research, and Dr. Linda Brent is heading the organization. The link is in the description here. And there's a list of veterinarians who are doing hormone-sparing sterilization and hormone replacement therapy. If anyone has any questions, I'm sure that either Dr. Karen Becker or myself will be available for, as much as we can be. But there's only 2 of us. And I'm sure that there's now many more veterinarians. And they too would be willing to actually go to different places and maybe teach colleagues. So I think it's just a matter of time, and we'll be able to see a big shift.
It falls on us. It falls on us, the pet parent. It is
Absolutely.
Our responsibility. If you are a pet parent listening to this, it is your responsibility and it's my responsibility to honor these 2 veterinarians that are here who are telling you, and to honor theogenologist Dr. Michelle Kutzler.
That's a hard word.
That's a hard word to say. But it's our duty to make it cool to the veterinarian. Imagine a concert. And there's an artist that all the cool kids want to hear, but the concert's not interested in that artist. And then the artist says, I'll come perform at your concert in your stadium for free. I'll volunteer. Stadium, concert organization, still not interested. But if the people want it, if the people approach the stadium, the concert, the organization, say, we want this artist, we want to hear these songs, guess what happens? Change shifts. If we, the pet parent, approach our veterinarians and say, we want change, we want ovary spares, we want vasectomies, and if you're not doing it, then I'll drive down the road and go find somebody else to do it. When you make it cool with the kids will inspire the change. When you make it important to the pet parents inspire the change. The pet parents have been shifting the industry since day one, man. Look how much we've achieved. It's pertaining to like ultra processed foods and the shift in the pet food industry. So obviously, if your pet can be healthier and live longer, that's all we want as pet parents, right? We just need the tools, podcasts like this, things that we can share to be like, God, I heard these people talking about this incredible thing. Here's the link. This is what I want. The onus falls on us to help push that, Peter. And so that's that's what I love about our community of 2.0 pet parents that are out there. They will push that change, and change will come. And man, Wasabi just changed those guidelines. I'll keep saying it over and over. We will push that change.
It's been such a great conversation. I know that many people will want to contribute not only their time and effort, but also money to the campaign and so on. We're going to post fundraising links to the description of this video and comments if you watch it on Instagram or other platforms. I'm so grateful for you guys. Not only you're my friends, and I miss you terribly. Like every time I get a message from you, I feel like I wish we were a little closer. But this is such a great conversation, and I think that this is history in making, and you're making it happen. And I want to thank you for being so brave. I want to thank you for being brave and not being afraid to face the resistance, face the pressure, because when others see you being brave, they too will eventually dare to be brave. So thank you so much for being here. And I look forward to seeing you again and for you to seeing Pax in real life and see how much better he's doing. And I hope that there are many more animals who will be able to benefit from the knowledge that we're gathering from these amazing researchers that we've been privileged to meet and connect with. So thank you.
Thanks for having us.
Thanks, Peter, so much. This is good. And you know what I'm thankful for? I'm thankful that we have a living, breathing, adorable, real life example in Pax that the whole world can track. He literally is telling this story for you, front and center. And we can watch his evolution of this story unfold in his body. And there's no better teachers than those fuzzy four-legged ones in our homes and in our hearts. And Pax really is kind of the poster child of this initiative, in that the whole world can see it, and he will help lead this good educational campaign into helping other pet parents make different decisions because of you telling his story. And so we appreciate you, and we appreciate Pax, and thanks for doing this.
I'll pass on the message and tell him he's got a job now.
That's right. And that Auntie Karen loves him and misses him. Yes.
And I miss you guys. We'll talk soon, okay?